us at info@njcapitalreport.org. Visit us online at njcapitalreport.org or find us on Facebook at facebook.com/Steve Adubato, PhD.
Dr. Poonam Aleg is the former commissioner of the New Jersey Department of Health and president of Aleg Care Associates. Good to see you, doctor.
Yeah, great to see you guys. Yeah.
It is good to see you now in private industry.
Absolutely.
But I'll tell you what, the reason we have you here, also beyond the fact that we love what you have to say about healthcare, is that there's a report that you've had a hand in. The Cato Institute put this together?
Yeah, they did the study.
In need of healing, Medicaid and the New Jersey budget. All right, let's break it down. This report argues, and you agree with, the fact that there is a crisis going on with Medicaid, and that Medicaid crisis plays itself out worse in states like New Jersey. Make the case. What is the crisis? Why is it worse in New Jersey?
As we know, the Medicaid population is a vulnerable population. When you look at outcome studies, and as a physician, you look at patients who need health care and healthcare access. Medicaid patients do have issues. They can't get appointments with their physicians. They end up going to the emergency room for primary care type services. So that's a big issue. On top of it, there's lack of coordination, lack of understanding what the system itself is. And if you look at any state, including the state of New Jersey, Medicaid is usually one of the top line items in the budget. So it's a huge piece of
so you're
where...
saying on the one hand, it's expensive, on the other hand, is inefficient and not very good.
Absolutely, because it is sort of the epitome of what's wrong with our healthcare system when it comes to fragmentation, lack of coordination, and lack of access, right? So those are some of the factors and variables that come into play in terms of why the U.S. healthcare system is costing us $2.5 trillion.
Hold on. Doctor, isn't it fair to say that the Affordable Care Act, passed by Congress, upheld by the United States Supreme Court, being implemented in January of 2014, isn't it supposed to make that situation better?
It is supposed to make that situation better. But for any state to go with one of the big provisions, which is Medicaid expansion, we have to weigh the pros and cons of what is important to us.
Break that down, no jargon. Medicaid expansion, what does that mean in a state like New Jersey?
So based on the Supreme Court ruling, every state has the choice of expanding the Medicaid eligibility to other kinds of population. For example, people who don't have children, but are the general assistance type population. And the states have that ability to do that up until a federal poverty level of 138%. Right. So that's an option. And in the original...
But it's an option. They don't have to include this extra population?
They don't have to.
Oh, okay.
And so that was what the Supreme Court ruling was about. In the original law, unless you expanded your Medicaid and participated in that expansion as a state, you would lose all of your federal funding for your current Medicaid program. With the ruling, with the Supreme Court ruling earlier.
So the Supreme Court ruling changed what the intention of the law was.
Yes.
The intention of the law was to cover all of these people, and that would somehow make it, you know, by scale, make it cheaper. But now, because it's an option, it's going to be
for
more
the Medicaid expansion. Yeah. So the feds cannot withhold its current funding to the state and hold the states hostage if they didn't expand the Medicaid program.
Right. Who's at risk? Who is at risk in the state of New Jersey in January of 2014, if the law is implemented as it is currently constituted? Who is at risk?
I think we all are. We as the taxpayers are, right? I mean, we as the healthcare community. So the governor and the team has an important decision to make right now, whether we go with Medicaid expansion or not. On one hand, we have a very rich benefit as it is for our Medicaid program. We have high eligibility criteria. We have lots of things that we cover. On the other hand, if we don't go into expansion mode, what's going to happen is that the hospitals, and you guys are familiar with the hospital situation here in New Jersey, the hospitals may suffer because the DSH funding, or the funding that goes to help with the safety net and the charity care in the hospitals, will start to be cut as a result of this law. So where are the hospitals going to get compensated for the patients who don't have any kind of coverage if we didn't go into Medicaid expansion?
Okay. So what are some of the things, I mean, there are other states who are doing it better, right? Are there lessons that we can learn? What's the ideal situation, given that Medicaid exists, given that that the situation will probably be as it is in 2014 unless it's changed? What's the best
I think
situation
you
in
mean
New
unless
Jersey?
there's a new president,
Yeah, unless
and
there's a new
unless the president can get people to go along and
right,
they
exactly.
get
Pulls the
repealed.
plug on
Right.
Obamacare,
Repeal and replace,
which is
right?
the so-called Obamacare.
Yeah.
Which is
I think that's a really great question, because I have to tell you, as a physician now, having done healthcare in so many different facets, I feel like I'm a kid in a candy shop. Everything I touch, I see innovation happening. Anything that any place I go, I see communities coming together, public-private partnerships. So things like the Medicaid ACO, which the governor signed.
Accountable care.
The accountable care
organizations.
right, where you're bringing communities together, all kinds of different healthcare players together, and saying, yes, we will be accountable to the care. We will bring efficiency into the system. We will help with care coordination. We will make sure that the outcomes are higher. I don't know if you guys had a chance to read the IOM report, the Institute of Medicine report just this week, that said 30% of healthcare dollars are spent as a result of inefficient systems, lack of technology.
Talking about wasting money.
Wasting money.
taxpayer dollars.
So these little things that we're doing around Medicaid, whether it's the Accountable Care Organization, whether it's looking at realigning reimbursement systems and aligning incentives so that we're paying for quality, not just for increasing the volume. All those things are terrific examples. Whether we're using healthcare technology and instituting them and enabling and empowering our Medicaid patients so that they understand what options they have and how do they self-manage their disease, whether it's acute or chronic. How do they communicate? One of the big issues that we're going to deal with here in the state is the healthcare professionals. We know that we have a shortage of physicians. Again, this is not new news. But as a result of it, I'm at the grassroots level right now. I see how we're communicating with patients changing, e-visits.
Particularly primary care physicians.
Exactly.
We don't have enough.
And
shouldn't we have more experienced nurse practitioners being able to do some of the things that primary care physicians did before?
Absolutely. The scope of practice, being able to practice to what your scope is going to be critical.
And doctor, just the last question. How optimistic are you that we're going to get this right? That all the players will figure it out?
Right.
Or even close to right?
I think this process is a process of continuous quality improvement. I'm very optimistic that we are going to get it right. Is that right going to be enough for that moment in time? Probably not. So it's going to be a continuous process where we're going to have to evaluate ourselves and continue to get to our destination.
Speaking of the continued process, make sure you come back, update us on the situation and also your perspective on it, because it is always an extremely valuable one. Thank you very much.
Absolutely. I love you guys.
Thank you, doctor.
We love that you love us. When we come back, conversation with someone else who really loves us. Nah. The Attorney General of the state of New Jersey, we're not so sure. Jeff Chiesa. We'll see you after the interview. Stay with us. We'll be right back. Thank you very much.